Greetings, I'm not Dr. Hall. What seems to be the problem today?
Well, recently I've been having trouble with my vision. I went and saw an optometrist, and afterwards he really had no idea what was going on with my eyes, which is why he recommended I see a neurologist.
So what seems to be bothering you then?
I've been developing these blind spots in my eyes, along with rapid twitching.
Have you been experiencing double vision?
A little.
Alright, I'm just going to take a closer look. If you can, follow this pen for me, alright? Now, do you ever have any problems chewing or swallowing your food or any other muscle spasms throughout your body?
Occasionally, I've been having trouble swallowing, and every now and then I develop this god-awful stutter.
Do you ever have problems lifting heavy objects, maybe even just everyday items?
I feel fine picking up items, but sometimes I feel extremely exhausted afterwards.
Do you ever have any burning sensations or numbness on your skin?
Usually a few times a week.
How about trouble with urinating?
Occasionally.
And do you ever struggle with sexual dysfunction of any kind?
Seldom.
Uh-huh. Do you ever feel your mind wandering? Like you can't focus on simple tasks?
Every now and then I find it hard to focus on certain tasks, even forgetful about others.
Okay. I want to run a few tests. Some neurological and some on your immune system.
Do you have any idea?
Well, I don't have a diagnosis yet, but as a prognosis, I have a few ideas. Do these spells come and go?
Yes, I'll be fine in a few months, then it will flare up again.
Well, it's still too early to narrow anything down, but it could be multiple sclerosis, commonly called MS. But before we actually set anything in stone, I want to run a few more tests. Okay?
What type of tests are you going to run on me?
First, I want to run a neurological test to see which part of your central nervous system is being affected. And then I'm going to check your motor ability to see what you still possess and what's lacking right now. Then I'll run a few blood tests and get an MRI scan to look at plaques in your brain. Also, if I do see any, it will indicate that this has occurred multiple times, indicating that it is likely to occur again. Lastly, I'll run a spinal tap to see what fluid is in and around your spine, especially to see if there's any antibodies that shouldn't be there. So eventually I did find out that our patient had MS. You saw in the video that he exhibited symptoms which are suggestions of MS, like poor vision, loss of motor function, and frequent spouts of symptoms which eventually disappear and then will flare up again. First of all, we should classify the 4 types of MS. So, the first type of MS that we're going to talk about is progressive relapsing MS. So, here we go right here. And now this is disability right here. And as time progresses on the x-axis. Now, what will happen is you'll see a slight sign of symptoms with an increased flare as symptoms and disability increases, and another flare right here, and this will continue. The second type we'll be looking at is secondary progressive MS, which has a plateau and then a sudden flare-up of symptoms. However, it doesn't go back down, it's slightly above it, and you'll see another plateau followed by another flare-up of symptoms, and so on and so forth, until it increasingly gets worse. The third type of MS we're going to talk about is primary progressive MS. There's no flare-up of symptoms, it just increasingly gets worse over time. It's just a linear trend. And the fourth type of MS we'll talk about is relapsing remitting MS. So we start out with a flat plateau, followed by a flare-up of symptoms, followed by a plateau, and another flare-up, and this will continue. as the disability gets worse. So, due to our patient having flare-ups of symptoms, I would rule out primary progressive MS, which was just our linear trend. I would rule that out. However, the other three are possibilities, with the most likely relapsing remitting MS, due to the fact that he has been experiencing these symptoms now for several months, and they've been increasing and decreasing. So, MS is a chronic and progressive autoimmune disorder. It occurs when T cells pass through the blood-brain barrier. Once they enter, they're going to attack these myelin sheets that cover the axons in the brain, and the myelin sheets will degenerate. So, along with the T cells attacking these myelin sheets, they're also going to release cytokines, which will cause dilation in the blood-brain barrier. So, this lets B cells, and we'll just say macrophages, enter. So what happens when the B cells enter is they're going to release antibodies that target the oligodendrocytes. And then the macrophages will come along, and they are going to attack the oligodendrocytes. Then regulatory T cells will reduce the action of the immune system upon the brain. These oligodendrocytes will remyelate the axons. However, over time this will stop and the oligodendrocytes will eventually die, leaving unmyelated axons behind. So there are no known causes of MS. However, genetic factors and environmental factors do play a role, with environmental factors including infections and vitamin D deficiencies. So on the screen right now, here's the MRI scan we took. You see a lot of white matter plaques, which indicate a loss of myelin. Also, we have high levels of antibodies in the cerebrospinal fluid. Lastly, treatment for the disease are few and far between. The medications only decrease the frequency, all being medications that only suppress the immune system. Some attacking the release of cytokines, which cause the dilation of the blood-brain barrier, which allow T cells and macrophages to enter. And others will just not allow T cells to enter the blood-brain barrier.